Good morning. Thank you for joining us for another edition of our Facebook Live. I'm Nancie Velasquez. I'm the Community Health Manager here based out of Omaha. This morning we have our patient benefits coordinators joining us. Sitting next to me, to my left, is Michelle Hallowell, and next to her is Sylvia Lopez Allen.
Good morning.
Morning. Thanks for joining us, ladies. So we have them joining us this morning because we have a lot of patients that have questions about Medicare, Medicaid, SNAP, and health insurance. So to hopefully get some questions answered for you, we're going to do a little bit of role playing and ask some questions of Sylvia and Michelle. So to kick it off, so as you know, I'm Native American. I use IHS services. Do I really need additional health insurance?
Yes. In regards to, we have with IHS, with Fred Leroy, Ponca Hills, we have limited services that are offered. You may well know we don't have radiology. We do have lab, but we outsource that. And there's a specialist that we do not have on staff. You need insurance because if you were ever needed to be referred out to one of those providers, a specialist provider or radiology, that will assist you in regards to the financial burden for those procedures or services. There's quite a few types of insurances that many of our patients do qualify, and that's Medicaid, Medicare, Marketplace, or the Federal Facilitated Marketplace, otherwise known as Obamacare, or with the Affordable Cares Act. There's quite a few names that it goes by, but also we do assist with financial assistance for people as well. If they were in the emergency room, they didn't qualify for Medicaid, and their marketplace isn't effective, their insurance hasn't taken effect yet. So there's other options that we can also assist them in regards to paying for those services.
Awesome. So we're just going to touch briefly on financial assistance. So like you said, we're going to piggyback off of what you said. If they don't have insurance or their marketplace hasn't kicked in yet. So if they do need financial assistance and they come to our clinic, what do we do? And how does the patient benefits coordinators work with the CHWs?
Usually, it's more done on a referral basis. So once we get a referral, or if the patient is there in the clinic at that time and comes down to visit one of us, what we do is we kind of get an idea in regards to their income. Because with financial assistance, anytime a hospital or facility is federally funded, they have to offer some type of financial assistance. And not many people are aware of that, nor do they elaborate that with their billing. But there are several different programs that are available. Bergen Mercy has one, Methodist, Emmanuel, Nebraska Medicine offers financial assistance. And that's kind of a lot of the documentation that you need. There's an application that you have to fill out, and then you have to provide supporting documentation in regards to your taxes, your pay stubs, things in that nature. And that if you did apply for Medicaid but were deemed ineligible, they may require that as well. So what the financial assistance programs with those facilities, they do offer, they can pay anywhere from 100% of the medical cost, even down to 25%. So that kind of helps relieve the financial burden for that emergency services, going to the ER, which we know is very costly.
Okay, so the financial assistance paperwork can, both yourself and Michelle can help fill that out.
Yeah, we have that available on site.
Okay, and along with the CHWs, they can help too. And then once we turn it in, it's strictly between the hospital and the patient then, correct?
Correct.
Okay.
But if they do want to follow up, they can always come to our office and we'll be happy to advocate for them in a conference call with the facility.
Perfect. That sounds great. Okay, so what's the difference between Medicare and Medicaid?
Medicaid is a state-funded program in which now with Nebraska, they have a Medicaid expansion, which a lot of people now are qualifying for Medicare, which they didn't in the past. So that's something good. That's for Nebraska that just recently became effective as of October 1st of 2020. So, like I stated, Medicaid's more of a state funded program, which that's what you have to apply with the state. And then Medicare is meant for people that are over 65 and or disabled. However, not everybody qualifies for Medicare. As you know, when you work, you contribute money to Medicare. And so it's kind of based off that you have to have, there's eligibility requirements for Medicare, in which you have to have a employment background in order to qualify. But just know that for Medicare, it's not free like Medicaid is. Medicare, you do have to pay premiums. However, the state offers programs that will assist people who are over income for full Medicaid, but are under, in regards to a certain federally poverty level.
So, Michelle, I have a question for you. How does one apply for Medicare Medicaid?
With state Medicaid, coming to our office, Sylvia and I, we have access to the applications online. So you have to, there's the eligibility financially, or there are financial eligibility requirements. So for the state, it's $1,073.
Well, that's in regards to the Medicaid savings program.
I'm talking about Medicaid.
Oh, but in regards to Medicaid?
Yes.
It varies in regards to, there's several different programs with Medicaid. There's Children's Medicaid, there's CHIP, which is Children's Insurance Health Program, is also Medicaid for children. There's Heritage Health Adult, and then there's the Aged, Blind, and Disabled program. And then also there's Pregnant Women program available.
Okay.
So, and the income limits differ in regards to you've got to take a look at in regards to your household size. So that's going to kind of determine which income you would need to have to qualify.
Okay. So, piggybacking that, Medicare, Part A, B, and C, correct?
Yeah, so there's two paths. There's the original Medicare, which is the A, B, and D, which D is the drug coverage. B is meant for outpatient services, radiology, laboratory, things in that nature, and then A is meant for hospitalization. Then that's one way you can go with Medicare, or you can choose to select a Medicare Advantage program. Medicare Advantage programs are managed by different health care agencies or healthcare payers, different healthcare payers, and that could be like a couple examples would be Aetna, Humana, Medica, and what the Medicare Advantage plan has. They offer extra benefits in which you don't receive if you go the original Medicare pathway. With the Medicare Advantage plans, they offer dental, vision, hearing, transportation, meals in regards to once you're discharged from the hospital and you're at home and you can't cook because of the procedure or whatnot, or while you were admitted, they will deliver meals to you. So with Medicare Advantage, there's benefits. However, when you go through the original Medicare pathway, as you know, Medicare pays 80% of the provided services, and then you're left with the remaining 20%. With the Medicare Advantage plan, you then will have to do co-pays. And co-pays are kind of a flat fee, could be when you go visit your primary care physician, or if you're referred to a specialist, and even like radiology, or you may have to pay a co-insurance. And co-insurance is a percentage of that service. So it varies, you could have to pay a 20% co-insurance for that service. Also with Medicare Advantage plans, there's in and out of network. With the in-network, it's kind of more of a HMO, which is a health managed organization, in which you have to stay within that managed care network, and you have to select your primary care physician. With the out-of-network, that's when you could see people outside of your network. However, the reimbursement rate is a little bit different from seeing somebody inside the network. So it may cost you a little bit more to see someone outside. But with the Medicare Advantage plans, there's several different types of plans that they offer. Like I said, the HMO, there's a PPO, which is a preferred provider organization, and that usually with the PPO plans, you have a little bit more flexibility in regards to what providers you can see.
This is definitely more than just like a 15-minute conversation to have with a patient.
Yes, I would agree.
So, Michelle, let's say I am going to turn 65 this coming year. When do I need to apply?
With Medicare, turning 65, you can apply 3 months prior to your birthday, during that period of your birth month, and then 3 months after.
Yes.
For Medicare Parts A and B. We advise that our patients do accept Part B, medical, which is medical. Part A is hospitalization, because if you do not go with your Part B medical, you will be penalized.
Yes.
From that point on, if you decide to opt out of the medical part of Medicare. So we like to advise our elders to take part of that so they won't be penalized, okay. Which would come out of their Social Security benefits.
And for each year that they opted out, it's 10% of that standard premium. So now this year, the standard premium is $145.10 for the Medicare Part B. Next year, it's going to increase to $170.10. And that's a monthly premium that can come directly from your retirement benefits, your disability benefits, or it comes from your benefits. So.
And that's monthly?
Yes.
Taken out monthly.
Okay. But what if a person can't afford the $170?
However, like I said, going back to, there's those Medicare savings programs. Now, the state of Nebraska offers 2 programs for individuals. The first program you need to make, you can't make more than $1,289 for a household of 1. Not only do you have to meet that monthly income requirement, but you also can have an excessive amount of resources. So for that program, you can't have any resources over $7,970. And when they consider resources, that's if you have an additional car, if you have an additional house or home, if you own other land or property. But just note that if you do own land or have a trust, that's not counted against those resources. So that I just want to make sure that that's clear, that if your land is in a trust, that amount is not considered towards the resources.
Also some
exempt.
Some life insurance.
Correct. And they look at burial insurance as also as another resource. Checking savings is a resource. Cash at hand is a resource. Okay. You're allowed to have, like I said, 1 home and 1 vehicle. That will not count against those resources. But there is a life insurance plan that will not count against those resources, and that it's an irrevocable plan.
Okay. So, if any of our tribal members, non-tribal members, would like to get in touch with our patient benefits coordinator, or coordinators, I should say. Michelle, who do they need to see?
They can see myself or Sylvia at the Friendly Way Health and Wellness Center. They can see Latasha at our Ponca Hills Health and Wellness Center and Jan Henderson at the moment,
Yes.
I believe, in our new Lincoln facility.
Okay, and Latasha is in Norfolk.
Correct.
So, we have patient benefit coordinators in Lincoln, Omaha, and Norfolk. And you can reach out to them at any time. Stop in, try to make an appointment though, of course, and you can give them a call. This is definitely a program where it's gonna take more than just one Facebook Live to try and cover 5 to 10% of everything that you guys know and have learned and try to teach our elders. And we would like to welcome you back again in the future to talk more about it. Again, if you have any questions, feel free to reach out to them. Would you ladies like to say anything else? Add anything else?
We do also assist with disability, so we will help with your initial disability application, SNAP, which is food stamps with the state, and also Every Woman Matters.
So Every Woman Matters is going to assist with your yearly women's annual checkup, mammograms for men and women, colonoscopies, colorectal tests. You can reach out to either the patient benefits coordinators or the CHWs to find out more information about the Every Woman Matters program also. And ladies, once again, Michelle and Sylvia, I would love to thank you for joining us today, and we look forward to having you back again.
Thank you.
Have a great day.
You too.